That's what we think you deserve. You're welcome to come for a second opinion, and you're welcome not to. That's your choice. It's a free country, but it's available, and the fact you're listening means that you now know there are options for cancer treatment that may be better suited for you than the treatment you're getting, especially if the cancer isn't responding or the treatment isn't tolerated. So again, this is Dr. Lederman at Radiosurgery New York. We're going to hear from a couple new voices, and we'll be right back.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you with body radiosurgery. We hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212 Choices, 212 Choices for a fresh second opinion. Most insurances, Medicare, Medicaid, accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212 Choices.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Call Dr. Lederman at 212 Choices, 212 Choices for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212 Choices. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212 Choices.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212 Choices for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Yeah, we're back, and we're live, and you can call up Ed or Bob. They're running this program, and they are fantastic. They're at the WOR Studios. All the studio power is on their shoulders. If you have a question or comment, just call us at 800-321-0710 during the program. That's the program phone, 800-321-0710. But a man I want to talk about just for a moment. He's a man who he chose to have our program for prostate cancer. Now, I know a lot of radiation is 9 weeks elsewhere. Well, why do they extend the treatment? Well, one is to give dose, and two, doctors get paid by the treatment, so you make more money. Why do we give half the number of treatments? Well, it's obviously not to make money, but it allows us to put radiation seeds in the prostate, and radiation seeds allow us to boost the dose. And if you look at the comparison data, there's markedly better results in our hands. Number one, because we use a stereotactic body frame, so it holds the patient in a very rigid position. And number two, we have experience with thousands, more than 3,000 men with prostate brachytherapy. We have our own operating room, so everything's done in half the time of the usual radiation. And if you look at the results, you will see markedly better results. So this man finished his treatment in the stereotactic body frame. I met him on Friday. He said, "Doc, I'm feeling great. I didn't feel a thing." I said, "That's what you're supposed to feel, not a thing." So he's very happy. He's doing great, right on target. He had his 5 weeks of treatment in the stereotactic frame, came in, got his treatment, went to work every day, did great, was feeling great, no side effects, and we'll report back to you, hopefully in the good news section of this show. Another patient, we saw a Russian immigrant woman who has stage 4 colon cancer. She had colon cancer, spread to the liver. She had a lot of chemo, it didn't work. She had surgery, it didn't work. She had she actually had 4 metastases, 2 big ones in the liver. We treated those with radiosurgery as a test. I tell you, well, we'll treat the worst ones and you see how you like us. And if you like us and it works, then we can talk about treating the other 2, the smaller 2. So we treated this woman. She's about 65, 70 years old. Russian, came here about 15 years ago. And the 2 lesions, the 2 cancers we treated in the liver, stage 4, shrank. It's the first time she had treatment that worked. And I know a lot of people go with stage 4 cancer, and the chemo guy says, well, it's stage 4, it's in your bloodstream, you have to have chemo. Well, you don't have to have chemo. You can choose to have chemo, and of course the argument that it's in the bloodstream, you should have something that goes to the bloodstream, is a good argument. But there's one defect in the argument which they usually don't tell you, and that is that chemo usually doesn't work or stops working. So if people knew that caveat that, yeah, it's stage 4, but chemo usually doesn't work or stops working, probably people would be less inclined to have chemo. So this woman gave us a chance, treated her 2 tumors, the big ones in the liver from colon cancer. Both at follow-up are in remission. And I said, well, do you want us to treat the other 2, the little ones? She said, yes. And her daughter called up, and I asked her, what do you want us to do? And she said, yes. So we're now treating the 2 little ones, and most likely, if the big ones are in remission, most likely the little ones will be in remission too. And then unlike chemo, where you take chemo endlessly, I mean, from a ticket from cancer to death, here she's off treatment, it's summertime, she's living her life, she's in remission, doing well, no side effects. She's happy. She even brought some apple turnovers for the staff and I. She is happy, doing well, and we're happy for her. It's a different option. It's something to think about. Yeah, you can choose chemo for stage 4 cancer. You can choose surgery. You can choose no treatment. But you might want to think about a treatment that has a high degree of success, that's non-invasive. You come in, get a treatment, usually don't feel a thing, and then live your life. Not that cycle of chemo, injection, lowering of blood count, side effects, neuropathy, infections, and you get hopefully better and then it starts again. No, it's a totally different way of talking about cancer treatment, focused on the cancer. It's not for everybody, but it might be for you. So I want to talk a little bit more about another patient. I see we're approaching the half hour, so I'm going to tell you about some other news. One is some also good news department, and this is an article in Health Day, and an article written by Amy Norton, that the number of new cases of dementia in America has been falling. It's been declining for decades. In the United States, in Germany, other developed countries. In one U.S. study, researchers found that since the late 70s, the rate of dementia diagnosis has fallen by 44%. And the sharpest decline was seen in people in their 60s. Yesterday, someone called in our WABC show. We have a show on WABC from 5 to 6 talking about, well, what's happening with cancer and what's happening with other diseases. And yeah, there is a lot of progress. 44% decline in dementia is pretty dramatic. There was a second study, and this is written again by Amy Norton in Health Day, and you can look online if you have any questions. Showed research from England, Netherlands, Sweden, United States with a similar pattern. And the third study from Germany found from just 2004 to 2007, the rate dropped by about 25%. So a lot of good news. Why is the rate of dementia falling? Well, probably related to better cardiovascular health, probably if the blood to your heart is going better, probably the blood to your brain is going better. One researcher, Claudia Stasipil, found that over the years, people's average blood pressure and cholesterol had improved. Rates of smoking have diminished. Heart disease and stroke have diminished. There's other studies as well and other links as well, but many people believe because a healthy heart and blood vessel delivering oxygen better to the brain leads to less dementia. So there's lots of good news out there, and we hope individually to provide good news, and we help to the vast majority of patients to provide good news. So lots of good news department. Here's a woman who's 53-year-old black woman. She's came from California. She's had a mass in her neck for 10 years. She went to one of the big hospitals in Manhattan. They offered to work her up with a biopsy, and they saw her in May and arranged the biopsy in August. So here she was seen on July 14th, Bastille Day, and we arranged to see her immediately and to get the biopsy within one day. It was so soon she couldn't make it. She already had other appointments for the next day, July 15th. So she wanted to do it 1 week later. So we're working up her lumps in the neck, maybe too soon, faster than she thought. She also heard on the program about what to do for dense breasts. Now, remember, last week we talked about dense breasts, and there's now laws in New York and other states that if you have dense breasts, which means the connective tissue in the breast is thick, so it's hard to read mammograms, that you're going to be warned. So you'll get a letter from their facility, you have dense breasts. Speak to your doctor. Well, what's being done about women with dense breasts? Well, of course, mammograms are not the best normal mammograms, but there's new technology called tomomammograms, and tomomammograms take slices through the breast, so actually radiologists can see what is in your breast better than with a normal mammogram. Now, you have to know about this, which is why we're talking about it. Imagine 40% of the women that have dense breasts haven't been getting this technology. It's a new technology. Of course, you get ultrasound, you can get MRIs. There's things you can do to evaluate dense breasts, but you may want to consider further workup. This woman, we got her arranged for tomo within 1 day. We got her arranged for the biopsy within 1 day. Elsewhere, she was waiting 3 months just for this biopsy, and she would go around with this mass in the neck for 10 years. So we believe that you should be offered to be seen, and we promise to see people within 1 business day. We have something called the Urgent Cancer Consultants, and we promise to see you within 1 day because we'd rather work harder than to leave you suffering or wondering what's going on in your body. So this woman came with a neck mass, biopsy arranged. She came with a dense breast, all arranged, and we'll report back to her. We have a caller on the line. Good morning. This is Dr. Lederman. You're on the radio.
Yes, Dr. Lederman?
Yes, sir.
Oh, my God. I didn't expect to get you. I expected to get, what a tape recorded, man.
Well, sorry you got me. I apologize.
No, I'm not sorry.
What's your question today?
Can we talk a second?
You're on the radio, if you don't mind 50,000 people listening to us.
Oh, that's fine. I have a friend of mine who is, has extreme cancer in the liver. He has cancer in, I'm not sure where else, the colon. And, he has been told that he has 2 years to live. What would you suggest I do with him? I have cancer, but it's stable right now.
Sorry to hear that. Anyway, I'm happy to speak to you. Probably it's better to talk after the radio program is done. I just spoke actually about a woman with colon cancer and metastasis to the liver and lung in remission after treatment. So we certainly treat people with colon cancer, with liver and lung metastasis, and we treat with other primary cancers as well. We were the first ones in America to do body radiosurgery. It's one of many options, and it may be a great option for your friend. If they don't want chemo, or if chemo's not working, or if other treatments are not available, we treat many, many people with colon cancer, lung cancer, breast cancer, prostate cancer, most all cancers.
Gotcha. Let's see. Okay, is there a number I can give him
The number you called 212 Choices, which is our office number, which